Hello, my name is Rege, and this is a short presentation about considerations on health literacy in general practice. I would like to start with a short introduction of the term health literacy. It first occurred in the 1970s and has undergone some slight changes since then. Today we understand it as a person's ability to obtain, understand, appraise, and implement health information in daily life in order to better self-manage your health. It's a term that has been receiving an increased amount of attention in health science over the last few decades. This is in part because we have seen our healthcare system become increasingly difficult to navigate in. We have seen a number of digital solutions, online consultations, and these things can all present a significant problem if you're not particularly computer savvy. What the research is telling us is that low health literacy causes some problems. On an individual level, it means that you will have a harder time engaging actively with your healthcare professional, and as a result of that, you are likely going to have a harder time managing your own health, especially if you have some conditions that you need to take into considerations. We also see how low health literacy can cause some socio-economical problems. As health literacy goes down, the cost of healthcare services goes up. There are some groups that are more vulnerable to low health literacy than others. Individuals suffering from chronic pain, such as chronic musculoskeletal pain, are very vulnerable. This is partly because chronic pain can be very difficult to understand. It often doesn't have a single reason. It's a variety of multiple factors that are combined, and it can be very difficult also for the healthcare professional to explain what is actually happening. So if it's difficult for the healthcare professional to explain the problem to a patient who already have trouble understanding it, then everybody's going to have a bad day. For workers, this can, well, for everyone really, this can interfere greatly with your life. For workers, it could mean that you will have a decreased workload capacity, or maybe you will have an increased number of sick leave periods. And this could ultimately have consequences for your income and for your job position. Therefore, the choice of treatment for pain is very important. In Denmark, general practitioners, they handle a lot of pain treatment. They serve as the first point of contact with the healthcare system, and they function as gatekeepers for the rest of the healthcare system. They treat pain with a variety of ways. They have analgesia and pain medication for one of them. And so for this current study, we aim to investigate if general practitioners take their patients' level of health literacy into considerations when making decisions on using pain medication as treatment for chronic musculoskeletal pain. We used a sequential explanatory mixed method study to incorporate both quantitative and qualitative data. It was set in Denmark, and we had Danish general practitioners as our participants. We started out with an online questionnaire and followed up with individual interviews. We had several domains, some of them being general practitioners' preferred pain treatment, general practitioners' attitudes towards self-literacy, and factors they found to be important, just to mention a few of them. 39 general practitioners completed the questionnaire, 7 of them participated in interviews. And what we saw from the questionnaire-based results was that less than half of the general practitioners considers health literacy to be an important factor when prescribing pain medication. However, the results from the interviews when we started talking to them showed that it does have some influence. They do take it somewhat into considerations, even though it may not be a standalone factor. It is not very determining. They talked about how this is something they just kind of do. So, skip to conclusion for this very short little presentation. General practitioners partly include health literacy of patients with chronic musculoskeletal pain in an automized and subconscious way when deciding upon pain treatment. So they do take it somewhat into consideration, but it is not something they consider a standalone factor. It is not something that they take directly into consideration, even though it does have some influence on their decisions. So that was the very short presentation on health literacy in general practice. I hope you enjoyed it. Thank you for watching.